So, hello and welcome. So, I know that this is our first live conversation from last year, and Happy New Year. I hope you had. I hope you had a. I hope you had an exciting holiday, and it's good to see you after the holidays. Um, and I hope you and your family enjoyed yourselves. So good to see you. So, today, as our first topic, we're going to talk about this issue of spina bifida. And so, we're going to wait a bit for a few people to join us, then we can get started. So, let's see who is here. Natasha Kateole, good to see you and welcome and Happy New Year to you too. Mangiza Esther, Happy New Year to you too and thanks. All right. So go ahead, tell us where you're watching us from, and also while you're at it, please tell us if the sound is good. If you're happy with the sound, we can proceed to discuss this very short but important topic, especially if you are a parent or you are planning to have children or you are already pregnant or you are planning pregnancy or you already have a child with this condition. This may help you as well. So this is a condition that is quite common and we see it quite a bit. And also, if you're going to watch this video later, happy holidays to you and welcome to the new year. So let's get right into it. So we're discussing this issue of spina bifida. Now, spina bifida is basically a Latin word. It basically means a split spine, and it actually means that literally. So a child is born with a split spine. Now, at the end of this conversation, there are a few takeaways that I'd like you to take away from this conversation. First of all, we'd need you to understand what spina bifida is. Secondly, how would you recognize it? What are the symptoms? And who is affected? Then we'll talk about the causes, and then we'll close with how to prevent it, and also maybe touch a bit on treatment. So, spina bifida, basically, like I said earlier, it's a Latin word that means a split spine. Now, when you look at the spine is basically a series of bones with a hole in between, and that's where the spinal cord sits. And you have these bones around the spine, there's the spinal cord, and those bones, their job is to protect the spinal cord. Now, sometimes in some children, unfortunately, those bones don't form very well. And as a result, the spinal cord gets exposed. Now, you may wonder, so what is the function of the spinal cord? Now, the spinal cord is basically an extension of the brain. So it's a tubular structure, like a snake, and it's an extension of the brain and goes all the way to your back. And its job is to extend the functions of your brain. So it controls everything. The way your brain controls everything from the neck downwards, it does it through the spinal cord. So the spinal cord is the highway for the brain for all the structures that are below the neck. So if there's any problem with the spinal cord, depending on the level, you're able to tell where the problem is, or you're able to tell, for example, if someone has a problem with their legs, you can actually predict at what level of the spinal cord is the problem. So basically, children are born with an exposed spinal cord, if you like. But again, when you look at the different types of spina bifida, there are some types of spina bifida called spina bifida occulta. Occulta is because it is hidden. So quite all right, the spine is exposed, but it's hidden. Hidden in the sense that you don't clearly see the spinal cord exposed on the outside. So that's one. Now, in terms of types, of course, we will not go into the technical details of the types of spina bifida. Just bear in mind that they are types. What we call spina bifida occulta is is the milder form, and usually you may not see the symptoms, or you may not see you may not notice that there's something wrong with the child until typically when you check the back of the child. These are children who have a tuft of hair on their spine, towards the lower back of their spine. You'll find that they may have a tuft of hair. So that may be a sign to show you that, okay, there could be spina bifida underneath. But otherwise, generally speaking, spina bifida, you have a child who's born and the back is just covered with like a membrane, and you can sometimes clearly see the spinal cord inside. And so that's what you see. How common is the problem? Well, you will find that out of 1,000 live births, 1 to 2 children will have spina bifida. That's how common it is. Now, very quickly, let's touch on the causes. Spina bifida, in terms of causes, you have, for example, if a mother has diabetes in pregnancy and the diabetes was poorly controlled, she may have a child with spina bifida. She may have a problem with the neurotube closing. Now, just because you have diabetes in pregnancy, it does not mean that you have a child with spina bifida. I need you to understand that. The issue here is if the diabetes is poorly controlled, or you didn't even realize that you had diabetes in pregnancy, you may end up with a child with spina bifida. The other issue is family history. If in your family there's been people who were born with spina bifida, you may also end up having a child with spina bifida. Maternal obesity, where you get pregnant and you are obese, the likelihood of spina bifida has been noted. If a mother is pregnant and she has very high temperatures during pregnancy, both internal and external, that has been associated with such problems. That is why we always insist that mothers need to go for antenatal early. There are some drugs that are associated with spina bifida, especially drugs that we used to treat epilepsy. So here's a mother who is epileptic and is on treatment. Some of these drugs that we give to treat epilepsy may also, expose the mother to the possibility of spina bifida. So meaning that if you are treating a mother and she falls pregnant and she's epileptic and she's on anti-epileptic drugs, you as a practitioner, you need to be mindful of the fact that you may need to make adjustments to protect the woman who's on these medications. The other issues that relate to just genetic problems within the baby itself can lead to the same. And the commonest, probably the leading cause of spina bifida is folic acid deficiency in the mother. So you get pregnant and your folic acid deficiency, then you have a problem. So that is why later on you'll notice as we discuss, people will tell you that if you're planning to get pregnant as a woman or you are trying for a baby, start taking, folic acid while you're trying for the baby. And when you get pregnant, also continue on folic acid. So there are those recommendations that people talk about, which we'll probably discuss later. So I will not bother you with the science behind it, but I just need you to understand that when fertilization has taken place, the spine should have finished forming between day 23 to day 27 from the time you conceive. So it is during that period that problems begin to arise with regards to this problem. But otherwise, those technical issues are probably a discussion for another day. So we've mentioned about the types of spina bifida. Now let's quickly talk about the issues related to what are the problems that come with spina bifida, and why are we even discussing it? Why are we talking about spina bifida? Okay, so the reason we're discussing spina bifida is because when a child has spina bifida, it is not just the spine which is a problem. They also end up with other issues that come with it. Because remember I mentioned that the spine is the highway that the brain uses to control everything from the neck downwards. But in children who have spina bifida, we've also noted that they may also have some neurological problems other than problems with their limbs at the bottom. So one of the things you will notice with a child who has spina bifida is that they may have what we call club foot, or they may even have a dislocated hip. So these are kids who struggle to walk. So if you have a baby and your baby is struggling to walk, or you have noticed that the baby has malformations in the legs, or the feet are, malformed, it's very possible that if you check the back, you find that your child may have spina bifida. The other suspicion is that because the spine also controls bowel movement, it also controls the bladder. When children are struggling to control the bladder and to control bowel movement, these are children who just, mess themselves up even after the age where they are supposed to be controlling these things, and they are struggling to control these things. You may want to check for spina bifida as well. Abnormal eye movement. So you have a baby who is born and has abnormal eye movement because of this. There's some types of spina bifida may come with a certain problem in the brain. Okay. And that problem in the brain can also lead to a child having problems with coordinating eye movement. So if you have a baby and the eye movement is not coordinating properly, there could be a chance that your child also may have spina bifida. The other issue is paralysis. The legs are just paralyzed and the child can't use the legs, or the spine child has scoliosis on the spine. Back pain. You have a child who is always crying and they are complaining of back pain. That's one of the features that may make you suspect that this child could have spina bifida. And also poor sensation. Sensation in the leg, sense of touch is poor, sense of temperature is poor. That could be a sign that your child may have spina bifida. So pay attention to these issues and you will find that these are the issues. One of the things you will notice, although in rare circumstances, because generally speaking, children with spina bifida, they are generally intelligent. But if there's a syndrome that is associated with the same, it's called Arnold-Chiari syndrome or Arnold-Chiari syndrome, depending on who taught you English. The child may also present with some, mental issues. Now, having said that, how then do you, as a mother, how would we know, or how would you prevent spina bifida? Now, before we talk about prevention of spina bifida, can spina bifida be predicted early in pregnancy? Yes, it can. So meaning that when you go for antenatal, as they are doing the ultrasound, they can actually look for these problems even before you deliver the baby. Now, this is why we emphasize that you as parents, the moment you discover that you're pregnant, make sure you do your scans regularly. Especially the scans in your first trimester are very important because that's when we're able to tell. There's also a blood test that can be done in the mother to check for possibility of spina bifida. There's a specific protein called alpha-fetoprotein. When that protein is very high in the mother's blood, you begin to suspect that there could be spina bifida. All right. Now, having said that, in terms of prevention, like I said earlier, one of the commonest causes of spina bifida is folic acid deficiency. So it means that you as a mother, as you are planning to get pregnant, it's very important that if you know you are planning pregnancy, even before you fall pregnant, you need to be taking, folic acid supplementation and continue on folic acid supplementation throughout your pregnancy. Which takes us back to the issue of attending antenatal early. Now, here's a child who's born with spina bifida. Is there a way of helping them? Yes, they can be assisted. Okay, they can be assisted. So this is where now your pediatric surgeon comes in. This is where your pediatric neurologist come in. Your pediatric neurologist come in also, and then even orthopedics. This is where they also come in because the child may need, assistance with the artificial means to move around. So they may need a walker or something like that. If they have club foot may need to be corrected. Okay. So even if a child is born with spina bifida, it is not completely a hopeless situation. The child can be assisted. And also, even when the child is born with spina bifida and all these things have been done, but your child now remains a child with special needs, it also means that this is a child who can also be enrolled in a school that takes care of special needs children. All right. So I know you may have questions, but This is what I wanted to bring to your attention, that, one of the things that can happen in pregnancy is that, is spina bifida. Doctor, some people say that doing too many scans is dangerous for the pregnancy. No, it's not. It's not. It's not dangerous. Please do the scans that are required. Of course, there is such a thing as doing too many scans, but do the scans that are recommended. There's a recommended number of scans you're supposed to be doing. Now, do us a favor, please go ahead and share this video as widely as you can, because we need a lot of people out there, especially parents, to be made aware of this particular condition, that yes, it can be prevented. Yes, it exists. Yes, you as a parent need to be aware of these things, so that even when you fall pregnant, these are things you can prevent. That even if a child is born with spina bifida, it's not the end of the world. Your child can also be assisted. So just bear that in mind, that this condition exists and it's out there. So click that share button and let's spread the word. That said, until tomorrow, do take care and good evening.